Well, warm welcome to today's talk. It's Monday evening, the 17th of January. Now, I've been getting literally hundreds of questions about the relative advantage of vaccination now we are in the age of Omicron, because we know that Omicron is causing less severe disease, and we know that there's fairly high amounts of immunity around anyway. In the United Kingdom, for example, as in the States, it's fairly similar. Over 95% of people have antibodies at the moment. So what should the advice on vaccination be? Well, let's look at the official advice first of all. And now, if we look at the advice from the Centers for Disease Control in the States, we see this was updated on the 12th of January. And basically, it looks like there's been no change, really. They don't seem to have changed the vaccination advice at all, as far as I can see. Everyone aged 5 and older can get vaccinated against COVID-19. COVID-19 vaccines are effective at helping protect against severe disease and death. The benefits of COVID-19 vaccine outweigh the known and potential risks, which are rare. And we could go on looking at the CDC advice in detail there, but I always put the link, of course, you can look at it for yourself. So that was updated on the 12th of January, well into the Omicron period, of course, and the advice seems to be the same. So what about the United? So that was the CDC advice there, and that's the reference. It doesn't seem to be any change. Updated on the 12th of January. UK Health Security Agency. NHS is offering COVID-19 vaccines to children, young people aged 12 to 17. So that's the same. That's as was. 2 doses of vaccine 12 weeks apart. Now, this is quite important. If the vaccine doses are 12 weeks apart, the UK authorities, and indeed some data, is showing that the likelihood of getting an inflammatory cardiac condition is less if the vaccine doses are 12 weeks apart. So that's what we're doing in the UK. We're giving it 12 weeks apart. And this does make a lot of sense to have this longer time gap. And we also know from previous data that the longer time gap actually improves the quality of the immunological response overall. It takes a little longer to get there, of course, because you've got a 12-week time gap. So that's what we're recommending. Or 12 weeks after a positive test. Now, this is another question get asked very frequently. I'm just recovering from COVID. Should I have another dose of vaccine? If I've had one dose, then you get COVID, then you get an infection. Well, the answer there is no. You should wait 3 months, at least 3 months, if you've had an active diagnosis of COVID, according to the UK Health Security Agency. Now, of course, the difference is that we're now... So that was the advice there. That's COVID vaccine and guide for eligible children. That's from the government site there. Check all these out for yourself. The change is this: hundreds of thousands of teens to get boosted on the NHS. So the boosters are the change that's just been announced. So actually starting today, starting on Monday, UK boosters for 16 and 17-year-olds, at least in England, starting today. 600,000 people aged 16 and 17 have had 2 doses already. So this is quite a lot of people that are now eligible for boosters. 800 and basically 900,000 young people have had at least 1 dose, so they'd have to have a second dose in order to get boosted. There's a lot of people now qualifying for boosters in the UK, and this is what is being advised by the, as we see there, we see it being advised by the NHS. Every eligible 16 and 17-year-old will be able to book their vital booster jab online from tomorrow, Monday. That's today. As the fastest and most successful vaccination programme in NHS history continues to expand, etc. And here we see various people singing the praises of the vaccine to try and promote it. So now, as far as I can see, the Joint Committee on Vaccination and Immunity guidance hasn't been updated yet. So they have issued this advice. It's been reflected on the NHS site, but as far as I can see, it's not actually yet reflected on the JVCI site. So that we expect that there next day or two. NHS cannot vaccinate 16 and 17-year-olds within 12 weeks, 84 days of a positive COVID test. I think this is an important point. And wherever you live, you've got to follow the local guidelines, of course, but that does seem like pretty good advice to wait if you've had an active infection. The reason being, of course, if you've had the active infection, you'll have antibodies, high levels of antibodies to the active infection. When you're given the vaccine will interact, because the vaccine is the antigen. The antibodies will interact with that vaccine-based antigen, and you'll get an inflammatory reaction, which of course is what we don't want. So they're saying wait at least 3 months. Some people might prefer to wait for longer than that, but that's what the official advice is, so that's what we are reporting here. Reduce further very small risk of myocarditis under 18. So they're saying the risk is very small of myocarditis under the age of 18, but that will reduce it further. Now, if you know anything about this channel, you know we don't like things like very small or not very much. So we want to try and quantify that a bit. Now, a good way to do that is look at the British Heart Foundation, which collects a lot of heart research. Oh, by the way, the UK is giving Pfizer rather than Moderna, because there's some intimations that Moderna can cause more inflammatory problems in younger people at least. So that's the policy in the UK. Now, this is the British Heart Foundation. That should be red, of course, but my printer's black and white. Can the COVID vaccine cause myocarditis is the first question. In most cases of myocarditis, heart function returns to normal. So I think the answer to that is, can COVID-19 vaccines cause myocarditis? The answer to that is yes. They just don't quite say that in those terms. Cases, while still very rare, are slightly less rare in children and young people. In other words, cases, while still very rare, are more common in children and young people compared to older adults. So it just I don't mean to be sort of cynical here, but you know, when things are put always in the positive, it just puts me in sort of, I just feel I should state the negative as well, because it's there. It seems to be written in a way which is very pro-government guidelines. Having said that, the British Foundation is not a government organisation. It's an independent charity, and it does a lot of really, really good heart research and publishes excellent materials. Cases, while still very rare, slightly less rare in children and young people. So in other words, they're more common in younger people. Millions around the world have had a COVID vaccine, and they say virtually all of them without long-term side effects. Well, virtually all. Again, it's not very quantified, is it? The this is a direct quote from the site. The Oxford AstraZeneca vaccine has not been linked to an increased risk of myocarditis. So why the heck aren't we giving it to selected people, younger people? Let me read that again. The Oxford AstraZeneca vaccine has not been linked to an increased risk of myocarditis. Now, it has been linked to an increased risk of thrombocytopenia, particularly in young women. So really, I have not seen the government say why they are not giving Oxford AstraZeneca vaccine to younger men, because the balance of risk there would seem worth elucidating to me. But we're going all the way down the mRNA route, which just seemed a bit strange, given that statement there is a direct quote, as we've said. Getting COVID-19 itself can lead to myocarditis. Well, yes, that is true. And what all these reports say is the risk of myocarditis if you have COVID is always greater than the risk of myocarditis from vaccination. Now, they don't absolutely spell that out in black and white terms for all the different age groups, but it's strongly implied. Who is at risk of myocarditis following vaccine? Mostly detected in young men aged 12 to 29. Nearly always, usually, well, they say usually, they're right, I can't remember the percentage, but by far the most common after the second dose of vaccine. Israel study found 4 cases in 100,000 men, but that's men of all ages as far as I know. So slightly, as far as I know, that's men of all ages. So it doesn't quite give the exact impression. Women, fewer than 1 in 100,000 for women. But again, presumably some of these women, it doesn't specify, but presumably some of these women were in their 80s and older women. Are children and young people at higher risk of heart inflammation from vaccines? Causes of heart inflammation after vaccines, while still very rare, slightly less rare in children, in other words, more common in children, in adults up to the age of 39. So again, they're putting it in very positive terms. So the UK, up to the 15th of December, 2021. So, okay, it's reasonably up to date. 12 to 17-year-olds, 39 cases of myocarditis or pericarditis, heart inflammation reported. That's 18 cases per million doses of vaccine reported. Now, having said that, I've personally talked to some young people who've had a degree of chest pain after vaccination, reported it to medical authorities, and it hasn't been followed up on. So is this being underreported? I strongly suspect it may well be being underreported. 18 to 29-year-olds, 29 per million doses. 30 to 39-year-olds, 22 per million doses. So we see it's most common in this young adult age group, mostly in young men. Medicines and Healthcare Products and Regulatory Authorities and the 4 chief medical officers, Northern Ireland, England, Scotland and Wales, confirm the Pfizer-BioNTech vaccine is safe and effective in children aged 12 to 15. Well, to say it's safe is overstatement. That's an all-inclusive statement, so I really can't say I agree with the chief medical officers there, to be quite honest. To say it's safe when we've just already said there's an element of risk does seem to be contradictory. Almost always safe or something like that, yeah. But safe means completely safe, and no medicine is completely safe. It's not safe to take paracetamol. It's overwhelmingly acetaminophen. It's overwhelmingly likely you'll be absolutely fine, but we can never guarantee it's safe. Safe is just not a term I like to use in healthcare. It's always a degree of risk, as well as vulnerable children from the age of 5, of course, and in the States, of course, it's all children from the age of 5. Now, this is an interesting one, thinking about footballers. Is there a risk of cardiac arrest following the COVID vaccine? Now, cardiac arrest, of course, means that the heart basically stops or goes into a condition called ventricular fibrillation. Cardiac output and blood pressure drop to essentially nothing. And of course, without treatment, that means you've dropped dead. Hopefully, you'll be treated with a defibrillator if it's ventricular fibrillation. But that's cardiac arrest. It doesn't get much more serious in medicine than that. And this is a direct quote from the British Heart Foundation. Is there a risk of cardiac arrest from the COVID vaccine? No, they say. There is no evidence that people are at risk of cardiac arrest in the days or weeks following the vaccine. So pretty definitive. Now, they quote a study here of 4 million vaccinated people from Denmark. From the 4 million vaccinated people, again, not age split up there, but there was 269 had heart inflammation. And of course, most of these would be young men. But they really couldn't have picked a worse example because, of course, on this channel, we've talked to Professor Niels Høiby, probably the most eminent physician in this field in Denmark. And he's advised the Danish government, albeit informally, but the Danish government have changed their guidelines as a result of Professor Høiby's advice, and they now aspirate the injections. So you would expect less cases of heart inflammation in Denmark because they're aspirating. I'll put the links to his video on. That's Professor Høiby's video there. Lovely gentleman, great scientist, highly recommended video. And Professor Høiby in that video did report to me directly that he'd done a statistical analysis on his data, and myocarditis 3 times more prevalent in Norway where they are not aspirating. So Denmark, where they are aspirating, we had, 269 cases. Norway, so Denmark, where they are aspirating, 269. Norway, where they are not aspirating, we would expect 3 times more, according to Professor Høiby on that video. So, and again, of course, in the UK and the United States, we're not aspirating as they are in Denmark, as we've talked about before. Found there were, back to the British Heart Foundation, found there were no deaths or diagnosis of heart failure in people who were diagnosed with myocarditis or pericarditis after being vaccinated. So that's good. So that's quoting the Danish study again. So this is the British Heart Foundation quoting the Danish study, which of course is where they do vaccinate. In the UK, no figures have been published for cardiac arrest in under 18s following the vaccine. So we simply don't know. And then there's a bit of a non sequitur here from the Heart Foundation, which means there have been a tiny number too small to be published or none at all. Well, either that or they weren't reported, so or recognised as such. So bit of a non sequitur there. It's a bit surprising the British Heart Foundation were so non-sequential. But there you go. Catching COVID-19, on the other hand, can significantly increase your risk of cardiac arrest and death. And I think the evidence for that, because we know that a complication of COVID-19 is myocarditis, pericarditis. That's not in dispute. Now, this is interesting. Is there a link between the COVID vaccine and cardiac arrest in football matches? Because we've seen, there was some player, I can't remember his name now, but he collapsed on the field not long after being vaccinated. So is there a risk? Again, they say no, there isn't. Now, very definitive statement here from the British Heart Foundation. Really very definitive. And unless that's backed up by definitive data, personally, I wouldn't want to be as definitive as that. But this is the British Heart Foundation. Although more research is being carried out into the long-term effects. Okay, so they're admitting there's unknowns about the long-term effects there. Having previously had a coronavirus infection is much more likely than the COVID-19 vaccine to lead to heart problems. Okay, I think we can accept that. Although these cardiac arrests may not be linked to coronavirus infection either. So these young footballers in the prime of life and the peak of physical fitness, professionals that have had cardiac events on the field, what the British Heart Foundation here is saying that there's no link with the vaccination, which I think is a bit of an overstretch from the British Heart Foundation. There could be some link. But they are saying, which I agree with, that it's more likely to be that they've had COVID-19 in the days or weeks before the great exertion of the football match. And it's the heart inflammation from the COVID-19 which has caused them to have a cardiac arrest. But that is supposition. So I just put this information to you as I read it and as I try to make sense of it. It's also worth noting that COVID-19 is more likely to cause myocarditis than the vaccine is. And I think we can accept that. So it would appear reasonable to infer that most of these cardiac arrests in elite sports people could well have been as a result of previous recent infection with COVID-19. But some still could be the vaccine, and quite how we differentiate between those, I really don't know. So I'm not sure we can. I wouldn't want to be as definitive as the British Heart Foundation is being. Now, this is important. How would I know if I've had it? So symptoms generally appear within 3 to 5 days, usually no more than a week. So we're talking about 3 to 5 days, typically no more than 7 days, usually. Pain or tightness in the chest, which may spread across the body. And the areas that would particularly concern me are those where we get myocardial pain. So pain in the centre of the chest, to the left of the chest, into the left arm, into the left hand, up into the neck, up into the lower jaw, down into the epigastric area about there would be the areas that would concern me most, because that's the classic myocardial distribution pain that we all recognise so well. That drum that into students over many decades. So pain or tightness, pain in the neck that may spread across the shoulder or arms. Good. So again, myocardial distribution, we agree completely. Shortness of breath when walking or doing gentle exercise. Now again, I've had several young people, and it's not evidence, it's just anecdotal, report to me that they have been short of breath. Sometimes for 2 or 3 weeks after the vaccine. Because you see, if someone has heart inflammation, I'd really want them to rest and not exercise. This is the big issue. Difficulty breathing when at rest or feeling lightheaded. Lightheaded could be low blood pressure or lack of oxygen, so we agree with that. Palpitations is being aware of the heartbeat, which could mean that the heart is beating irregularly or feeling like you need to be sick. So any of those after vaccine, 3 to 5 days, or in the first week, certainly. Or of course, any time you want to, report that immediately to your doctor. And certainly on an accident and emergency department, anyone who comes in with chest pain, we would do an ECG, or that's an EKG in the States. It's exactly the same investigation, just with a slightly different description. Can vaccines cause change to the heartbeat? Well, you get a bit of a fast heart rate after the vaccine anyway. And that's not surprising, because the body's mounting an immunological reaction. So if you have an infection, your heart rate will go up because you're mounting an immunological reaction. So that's not surprising. But will it go very fast, like a pathological tachycardia? Well, it doesn't really answer that. Doesn't really answer that question. Tachy just means fast heartbeat, tachycardia. So it doesn't really answer that. I've heard people. I've heard about people getting myocarditis of the vaccine. Should I have my second booster dose? So they say yes, you should. If you're worried, still get your booster dose. That's what they're saying. I was diagnosed with myocarditis after having the vaccine. Should I go ahead and book my second dose? Well, if you've had complications with first dose of the vaccine, I would not take a second dose of a vaccine unless a senior physician told me to. So, and thankfully they agree with that. No. So if you've had heart inflammation after the first vaccine, you should not have a second one. And of course, if you're talking about perhaps women who've had thrombocytopenia, thrombosis after the first dose of vaccine, or neurological symptoms after the first dose of vaccine, you certainly would want to take very senior medical advice before you had a second dose. Certainly wouldn't be a decision for a local vaccinator. So good to see they're saying a no there. I've had myocarditis or pericarditis in the past. Should I still have a COVID vaccine? They're saying yes. Myocarditis, most commonly in young people, of course, is caused by viral infections. And when they go away, hopefully the myocarditis will as well, though of course people can be left with myocardial damage. But the advice there is, if you've had myocarditis in the past and it's unrelated to the vaccine, then they are saying carry on with the vaccine. Again, personally, I've been more comfortable with a cardiologist advising on individual bases on that, but there you go, that's what they're saying. Are there still unanswered questions? Yes, there are. Okay, so that's what the British Heart Foundation is saying in terms of evidence. Now, let's just look at a couple of videos. The first one is a Canadian bloke with a tattoo getting vaccinated. Let's just watch that and just watch carefully what the vaccinator does. So first one, Canadian bloke. Here we are. In we go. Straight in, no aspiration at all, into Canadian bloke with tattoo. There you go, she didn't aspirate. And she must know she's being videoed. What about Mrs. Trudeau? Well, here's Mrs. Trudeau. Is she going to get aspirated? Inject straight away, no aspiration either for Mrs. Trudeau. It makes me uncomfortable to watch people getting vaccinated. Now let's look at a British bloke here being vaccinated. So this one's British bloke. In we go. Injecting straight away. Lots of photography, but no aspiration. Looks pleased with himself.
Okay, absolutely fine.
So good for you, British bloke.
You're not going to bleed on me.
And this is a doctor who's doing the vaccinating here. But of course, it's not just any doctor. It is Sir Professor Jonathan Van Tam, at the time Deputy Chief Medical Officer,
absolutely fine.
who was apparently happy to go on TV, vaccinate the then Health Secretary Matt Hancock, and not aspirate. And it just makes me squirm seeing an intramuscular injection being injected without aspirating. Now, of course, you've heard me talking to you there, or you can watch the Chief Medical Officer. Now, to be fair, the Deputy Chief Medical Officer was following the guidelines. It's just that we think the guidelines are wrong. Now, if Professor Van Tam would like to come on, I would just love to have him on, and we would talk about this in an open way. And, he's one of the most senior medical professors in the country. If he wants to give me his medical rationale, I'll just sit there and say, yes, Professor, I understand now, but explain it to me, please, because at the moment I do not understand how you know when you stick that needle in, a muscle, how the heck do you know you're not in a blood vessel unless you aspirate? The answer is, I don't think you do. So, open invitation. Sir, please, love to talk to you. Won't be adversarial, it'll be a genuine me seeking for information as to why you perform injections as you do and why as per the guidelines. Now let's look at an example from Cumbria, a local nurse from Cumbria. Let's see if this young lady gets anything better. So drawing the vaccine up, in we go, draw back and give it. What is so hard about that? Thank you, ma'am, for giving a good demonstration. In, are we in a vessel? Draw back. No blood, therefore we're not, therefore put it in. There we go. So, do watch the video with Professor Niels Høiby. Myocarditis, 3 times more common in Norway, where they do not aspirate, compared to Denmark, where they do aspirate. So that's the advice. So there's no question that the risk-benefit analysis has changed now in the light of Omicron, because we know Omicron is intrinsically less pathogenic and we know there's an awful lot of immunity around. But we learn now that the UK government and the US government haven't changed their guidelines. In fact, the UK government have extended their vaccination guidelines to recommend boosters for 16 and 17-year-olds in England. And I hope the information I've given you here makes you able to make a more informed decision. And thank you very much for watching.